Hello, and welcome to the CMS National Training Program podcast, brought to you by the Centers for Medicare and Medicaid Services, or CMS. We're here to help our partners and the public better understand CMS programs. The information in this podcast is not legal guidance or intended for press purposes. Official Medicare program legal guidance can be found in the relevant statutes, regulations, and rulings. With that said, I am your host, Michaela Wright. From time to time, CMS gets questions about various topics, and today we'll answer a few of those questions with the help of Daniel Simmons, our Medicare specialist. Thank you for being here today, Daniel.
Hello. Happy to be here, Michaela.
We have a few Medicare Advantage enrollment situations we'd like to ask you about.
Absolutely. Let's do it.
Okay. We've had a few folks say they were enrolled in a Medicare Advantage plan, also known as an MA plan, without their permission.
So sometimes people with Medicare are enrolled into an MA plan without their knowledge. It could be because an insurance agent enrolled you into a plan, but you weren't aware of it. CMS calls this marketing misrepresentation because the agent may have misrepresented something or they could have made an error. Another thing that can happen is you're enrolled in an MA plan and the plan leaves Medicare.
The plan leaves Medicare. What happens if your plan leaves Medicare?
This can be for a number of reasons, and if it does happen, CMS can reassign you to a new MA plan. But don't worry, CMS will notify you and they'll give you a chance to choose a different plan.
And when does that happen?
That's in the fall, and your new plan coverage begins on January 1st of the following year. CMS will mail you a notice.
Perfect. Anything else?
To ensure you get the notice, contact Social Security to confirm your address is up to date. And make sure that you're thoroughly checking your mail for notices and don't accidentally throw it out without reading it. If you have any questions about the notice or the reassignment process, call 1-800-MEDICARE.
Got it.
And if you believe you've been enrolled in a Medicare Advantage plan without your permission, call 1-800-MEDICARE, that's 1-800-633-4227, or contact your local state health insurance assistance program office, or SHIP, for assistance.
Okay, here's our next question. A few people asked what you should do if the MA plan cancels your coverage and you're not sure why.
First off, you have to live in the plan's service area to get coverage. Depending on the type of plan, the service area may be limited to a county, certain zip codes, or an entire state for some regional plans.
Because the plan uses your address to determine if you live in their service area?
Right, and they may cancel your coverage because they think you no longer live in their service area, even though you really do.
Now, how could that be?
Sometimes that can happen if your mailing address is a post office box that's outside the plan's service area, or if you use a temporary seasonal address because you live in a different place at certain times of the year.
Like snowbirds who move south every winter.
Exactly. It can also happen if you have a caregiver who receives mail for you at a mailing address outside the plan's service area. Or maybe you live in a large metropolitan area or rural area that's in the service area, but you have a mailing address in another county.
So what should people do in these cases?
If any of these situations apply to you, notify your plan to prevent confusion and possible cancellation. They can make a note in your file to keep you from losing coverage. And in general, you should always let the plan know about any changes to your mailing address or residential address. If you move out of the service area without telling the plan, your coverage can be canceled.
What happens if the plan gets mail sent back to them?
They'll try to contact you to confirm your address, but if they don't get a response, the plan will disenroll you.
That's important to know. So what if your plan has your correct address on file and you haven't moved, but the plan still cancels your coverage?
Then it might be because the plan changed its service area and no longer provides coverage where you live. CMS does allow health plans to expand or reduce their service areas based on their business decisions. But there's a formal process that requires the plan to inform CMS before changing their service area.
Got it.
If the change impacts your coverage, CMS requires that the plan notify you within certain time frames in the fall, and you should enroll in a new plan so you have coverage.
What if you didn't get the notice or didn't read or understand the notice? You could be confused when you realize you no longer have coverage.
You should contact your plan right away if that happens. You can also contact CMS directly at 1-800-MEDICARE or contact your local SHIP office.
All right, on to our next question. We sometimes hear that people enrolled themselves in a Medicare Advantage plan by mistake.
Okay, so some of the same companies that offer employer or retiree plans also offer MA plans and Medigap policies. It's possible to confuse them. If you have coverage through a retiree plan, an employer, or a union, and then enroll in a Medicare Advantage plan thinking it's extra coverage, you could lose your other coverage altogether and you may not be able to get it back.
And what's the best way to prevent that?
Always contact your benefits administrator before making any changes to your coverage, such as enrolling in an MA plan. If you lose your employer coverage, you need to contact Medicare quickly to preserve your rights.
Good advice. And our last question today, why is my plan charging me a penalty?
This is usually a late enrollment penalty. You might have a penalty if you go 63 days or more without creditable prescription drug coverage, and then join an MA plan that includes prescription drug coverage, Part D, after you're first eligible.
The Part D late enrollment penalty is added to your plan's monthly premium.
What do you mean by creditable prescription drug coverage?
That's prescription drug coverage through an employer plan or Veterans Affairs, for example, that's expected to pay, on average, at least as much as Medicare's standard prescription drug coverage.
Why would the agent not tell you about the penalty?
Sometimes agents enroll people in an MA plan or drug plan and don't ask about prior coverage. Also, they don't have a way to know how much the penalty will be. After you join, your plan tells you if you owe a penalty and what your premium will be. You can call 1-800-MEDICARE, 1-800-633-4227, or contact your local SHIP office for assistance. You can also contact Social Security for Part D penalty questions and appeals.
Okay, great. Thank you for walking us through some possible answers to these questions, Daniel.
Absolutely.
That concludes this episode of the CMS National Training Program podcast. Thanks for listening. You can find out more about Medicare Advantage enrollment at Medicare.gov under What Medicare Covers. And visit the CMS National Training Program website for more training opportunities and resources. Until next time, stay healthy and stay informed.